So our next topic is infection. Remember, you have to keep the timeline in mind. First 24 hours, a temperature up to 100.4 is probably dehydration. After 24 hours, we're thinking more of infection. The first 24 hours, occasionally you will see an infectious process, but those are the people who have had an infectious process brewing already, such as someone who has had prolonged rupture of membranes. But for the typical woman, you're not going to see an infection, the temperature part of the infection, until after 24 hours. With an infection, you're also probably going to see abdominal or fundal tenderness. It never feels good to massage a uterus, but this one is really bad. And foul-smelling lochia. Assessment of infection, same kind of stuff you do in all infections. Like I said, it may be tender. The uterus may be tender, and it also might be larger than expected. Add on to that the fever, the malaise, the abdominal pain, the foul-smelling lochia, all of that, and the tachycardia that goes along with most infectious processes. Okay, how do you prevent it? Well, in some cases you can't. If she's had prolonged rupture of membranes and you're getting her postpartum, it's already been going. But we want to try and prevent it. So good perineal care, teaching them about that peri-wash bottle, teaching them about hygiene and the wiping from front to back to prevent fecal contamination up in the vaginal area. Thorough hand washing, sitz baths, adequate fluid intake, and a diet high in protein and vitamin C will also help her body to fight off an infectious process. Now that was all uterine infectious processes, pelvic abdominal processes. Now let's look at mastitis, where here we're looking at the breasts. And it's caused by milk stasis and bacterial invasion. We don't see this in the hospital anymore because it develops once they go home. So what makes milk stasis? Well, during the engorgement process, the mother may have more milk than she needs, and it's just kind of sitting there in her breasts, and she's feeling miserable because she's not completely emptying her breasts. And the other thing that we do make a difference with in the hospital is cracked nipples. Anytime you break that skin barrier, you've created a pathway for germs to come in and cause an infection. So when we're doing an assessment, say you're working in a doctor's office, we're looking at breast consistency. That means lumps. We are looking at skin color. Do we have reddened areas? Do we have warm areas? It's not usually the entire breast. It's one area where you've got a lump and it's reddened and it's warm. We're looking for the nipples. Are they cracked or blistered? And we're looking for pain. Those lumps are tender. They hurt. What are we going to do about it? Well, while we're in the hospital, we're working on teaching her proper latch on. If she's coming back with an infection, we're looking at proper latch on again. Hand washing, completely emptying the breast. Now this may mean using a breast pump after feeding for the time being to get that infectious process out of there, the infected milk out of there. We should be teaching people in the hospital when they're breastfeeding to empty the first breast first. First of all, what that means is you empty the first breast completely, and then you move the baby to the second side. Whatever the baby wants on the second side, they take. And then the next feeding, you start with that one you left off with and empty it completely. So there is some breast emptying, complete emptying. What that does for the baby is the hind milk is very high in fat, so the baby grows better. And what it does for the mom, completely empties the breast, helps to stave off infection. Warm compresses to the area may also help with the circulation, get those ducts opening up, and with a massage to the area of the lump, warm compresses and then gentle massage through the compress will help to move that milk out through the ducts. Quite often there's a blocked duct, so you want to gently help move the milk through the duct out of that lobe of the breast. And antibiotics are quite often standard part of the treatment. The baby can continue to breastfeed with these antibiotics and with this infectious process going on. It will not hurt the child.